had every nursing position you can have at hospice except that one. I was a regional manager and administrator and on-call nurse at night. I'm on-call, I mean a nurse during the day, an inpatient nurse, outpatient, whatever. So, educator. So I've had a lot of experience with hospice mostly. So I've seen a lot of end-stage diseases, particularly Alzheimer's and other types of dementia. So they were always my favorite patients. There's just something about them that's just dear to my heart. So when my mother was diagnosed, you know, first we denied it for a really long time because she lived up here in Shreveport by herself and I lived in Austin. So, and I loved my job. I was in a hospital at that point. Didn't really want to move, so we kept thinking, oh no, she's just got some memory problems and, you know, she's okay. She just has ADHD, you know, adult. But then she started getting lost, and so okay, she wouldn't come to Austin, so I moved up here, and I'm not sorry at all. You know, it was hard financially, and I had to leave my career that I loved, but it was worth it taking care of her. And she passed away in 2020 in August, right in the middle of all the pandemic mess. So there was a period of time when I couldn't see her. So I had just gotten back in for about a month before she died. So, but it was a long, strange trip, as they say. So anyway, so I'm here to talk today about personal care and hygiene, because I have been in the trenches quite a bit with just the day-to-day care and helping people figure out how to do things. So dementias are mostly progressive, no matter what kind they have. Not all the time, but almost all of them are. And over time, hygiene and grooming sort of takes a back seat as they forget the time periods between when they've washed or, you know, had their hair done, and then sometimes they forget to bathe. Just personal care just gets on the back burner. So think about, though, how many steps it takes to take care of ourselves every day. You know, there's big steps and little steps. You can say getting dressed, and that's a big step, but think about all the little tiny things, like how to pair up your pants and your shirt, how to choose the right socks, how to get those socks on, how to work a zipper or buttons. I mean, there's just hundreds of little steps that we take for granted every day. But as people decline, they're going to start forgetting how to do those things. So, you know, we'd be surprised at what people will put up with, you know, or somebody who's been always neat and tidy all of their lives. And my mother was one of those. She always wore makeup. She'd spend an hour getting ready every day, even if she wasn't going anywhere. And all of a sudden I'd come up here and she'd have on no makeup and this stupid wig. This was just not my mother at all. And she just didn't remember how to do any of those things, and they didn't really matter to her anymore. So, but it was a little bit hard to get used to. So you might notice that somebody's been wearing the same clothes for a few days because they're kind of bad about doing that, or they might have some body odor that they just don't seem to be aware of. So, you know, when you first start noticing things, sometimes a little prompting will help. You know, you really need to brush your hair, Mom, or, you know, why are you wearing that wig? Why don't we wash your hair? And you'll oftentimes just get a flat no. They don't want to, because it's a little bit scary to them. And also think about how it must feel to have, you know, your spouse or your caregiver, you know, somebody that you know really well, all of a sudden telling you that you need to go take a bath, you know, that you smell, that you need to take a bath. And it's insulting. It makes them feel like they've, you know, are back to being a little child again, and they need somebody to take care of them and tell them what to do. So that's pretty unsettling. And also, when we suggest that they take a bath in the morning or early in the day, and they're used to taking a shower at night, that's not their routine. And so that can be kind of insulting too. So making decisions about what to wear are just overwhelming. You just open the closet and there's this myriad of clothes and shoes, and sometimes it's just easier to close the closet door and just not get dressed, not change clothes, because it's just too hard. So, you know, at some point you're going to have to figure out how to tell them that this really needs to be done. So be very cognizant of their feelings when that time comes, and how you say something and what difference it can make. You know, if you're real roughshod about it, you're going to get a huge denial. And I liked what the 36-hour day book, I love that book, and it says in there, most people with dementia resist bathing with unparalleled determination, which I thought was a great sentence. So anyway, really cognizant of their feelings. And then the actual bathing, as a person declines mentally, they're also going to decline physically. You know, it's just kind of a parallel. The brain is being attacked, and all parts of it are going to go down, you know, in pretty much the same time. So things change, and it gets much harder to get in and out of a tub, or even in a shower if they have to lift their foot to get over the stoop. You know, can be really challenging for them. So you got to think about safety things, and the sooner the better if you're going to be taking care of someone at home. So if you don't already have grab bars installed, now would probably be a good time to get that done. You can get some that fit by the toilet. You can get some that'll fit on the edge of the bathtub so that they can have two things maybe to pull up with. But just some things to think about. And make sure you have some non-slip mats or those strips, but really look carefully at those strips because sometimes they're not all that good. So pay attention to those. And as their vision changes with the dementia, they're not going to be seeing things as clearly as they once did, and not processing what they see. So if you use a high contrast color, or you know, something that just is completely opposite from the tile or the bottom of the bathtub, it'll be a lot easier for them to see. And also get a non-slip mat for where they're going to step out of the tub, you know, or the shower, something that just isn't going to move under them. And have plenty of towels, enough for the U.S. Army, because the bathroom's probably going to be pretty wet, especially the first few times, and you might be wet as well. So be prepared. But you know, taking a bath isn't all that bad. But when it's appropriate, it's a good idea to use a bath chair or a bath bench. I don't know if you're familiar with a bath bench. A bath chair fits inside the tub or the shower. They're nice and sturdy. That makes the person feel safe because they're not going to slip and move around. And they have handles, so if they're panicky, they can hold on to the handles. Most of them have seat backs, which is good for people that have a balance issue. And then a bath bench, I just took a picture of one, is a longer version of a bath chair, and it's made so that part of it fits outside the tub. So if they're having trouble getting, you know, lifting up their leg to get all the way into a tub, and they really like tub baths, you can put them on the outside portion of the chair and then help them get their legs into the tub, and then they can just scoot over to where they're in the tub. And some of them even have a seat that'll slide down the rails. I think it'd probably be better just to scoot that. Those sliding down the rails might be a little scary for some people, but that is a really nice piece of equipment. Okay, if you haven't already installed a handheld shower, that's almost a must-have piece of equipment. First of all, you have control of the water and the mess. It also helps alleviate any having the shower just pound on their skin constantly, because that can be kind of painful for somebody who's older, and especially if they didn't want to be there in the first place. It can feel like stinging to them. So the little handheld shower, you can put it on where it's just running just enough to get them rinsed. It doesn't scare them as much when you use it to wash their hair. And they don't feel like they're going to drown because there's not water in their face. So they're pretty good, and they also help keep you from having to launch yourself into the shower with them if you don't want to. Now, if you're the partner or the spouse or someone who's known them forever and ever, and you want to just get in the shower with them, then go for it. You know, that's okay. It might make the whole process easier in the long run. Anyway, stay away from bath oils and bubble baths, because not only are they slippery, but for women they can lead to bladder infections. So kind of stay away from those. Maybe uncomfortable. Hi.
No worries, no worries.
And I'm real soft-spoken. If you can't hear me in the back, please let me know. I'll try to speak up a little louder. Always check the water temperature before it touches their skin. And even if they've always been pretty good at gauging what the water temperature is before they get into the tub or shower, that ability to gauge temperature with your hand can disappear really fast, and you're not going to know when that happens. So check it first before they get in. And you know, of course you never ever leave them alone in the bathroom. Just like a toddler, you would never want to leave them alone, because the falls are mostly going to be on a slick floor in the bathroom or sliding down in the tub, you know, so never leave them alone. And if they really want to take a tub bath sitting in the tub, 2 to 4 inches of water is plenty, and they won't feel like they're drowning. And if they did happen to slip down, they're not going to drown, you know, because they may not be able to get up. So watch out for that. And then sometimes in later stage dementias, the bathroom mirror can be frightening, because there's a naked person in there that they don't recognize and can really scare them. So if that starts to happen, just cover the mirror up with a sheet and leave it there so that, you know, you can judge when to take that sheet on and off. So there's
The bathroom mirror scares me now.
I know. I know what you mean. Who is that? Oh, let's see. So the shower chair and the bath bench and all that can be purchased by yourself, or they can also be qualified as durable medical equipment. And there's a difference between durable medical equipment and medical supplies. So durable medical equipment are things that are generally going to last about 3 years or more. They can be reused. They are defined as equipment used in the home to aid in a better quality of life and is medically necessary as determined by a physician or a specialist. And I have a little attachment here you're welcome to a copy of, because it does get confusing sometimes as to what goes where and what you can report to your insurance company that they might cover. Generally they will cover them, but you're going to need more documentation than you think. So you're going to need to get like I was at Drug Emporium just a little while ago, and the bath benches there, I think I saw one for, it was over $100, maybe $135, $45, something like that. That would count as medical equipment, but you need a letter from your doctor saying that this is medically necessary, and then you can turn it into Medicare or whoever your provider is, and it'll probably be covered. So you may have to pay 20%, but anyway, it's a pretty good deal. So things that are counted as durable medical equipment generally include canes, glucose monitors if they're diabetic, walkers, wheelchairs, hospital beds, CPAPs, if anybody wears a CPAP, toilet safety frames so that they have something to hold on to getting on and off the toilet, and bedside commodes. So, and there's a lot of others, but those are just kind of the general things that we dealt with all the time. Medical supplies, on the other hand, are not reimbursable by your insurance company. They are things that are used once and, hi, come on in, and generally disposed of. So that would be your soaps and shampoos and creams and things like that, diapers. Yeah, a lot of people really want to claim diapers, and I haven't found any insurance company that will cover those. So anyway, here's just a little general list. Looks like this, and I've got a bunch of copies right here. So let's get back to that bath. So if they're really determined not to take a bath, they're probably, you know, they aren't as able to verbalize their fears as we can, because they cannot process all of that, but they know they're scared, and a lot of times they're afraid of pain They may have some pretty bad arthritis, and when they stand up for a while, or if they have to lift to get into the bathtub or shower, it's probably going to set off some pain. So, that's pretty easily treatable with a NSAID and non-steroidal anti-inflammatory. It's been a while since I've been in the nursing field, but or some other over-the-counter medicine or something that they have for pain that's not going to make them sleepy, because you sure don't want them getting sleepy while you're trying to bathe them. They are going to want the room temperature to be much warmer than you probably like the room temperature. So take care of that, and then they're probably going to want the water to be cooler than you would like it to be. So you don't want to injure them with that, but they're afraid of that. They're afraid of falling because they know that they could easily fall. They feel unwieldy. That's why they're moving slow and holding on to things. They know they're a fall risk. So, and sometimes, like I said, the shower beating on their skin can be like stinging. So that's not fun for them. And then shampooing their hair, getting water in their face, all these things that they might be thinking about can make a bath or a shower prospect pretty unpleasant. So they'll dig in sometimes. So if you can, get down on the level with them so that you are on their face level. You squat or sit in a chair with them and try to probe and see what it is specifically they're afraid of, if they can tell you. And offer them lots of reassurance that you're going to make sure that everything goes well, and they're going to do just fine, and they'll be nice and clean, And if you need to, sing some little songs. That most people with dementia will respond to songs even if they're not talking anymore. They love little songs, like old songs everybody knows, like row, row, row your boat. Just things that you can sing together, and you can get them through this whole thing, just doing that. And then as it becomes more routine, their resistance is going to decrease. They'll get used to it, and they'll do a lot better. And on days when they really don't want to take a bath, that's okay. Just change your frame and do a sponge bath at the sink instead, because that's easy, and most people know how to do that without any problem. And they might be a little more cooperative. So you don't have to do a bath or shower every day. That's just really not necessary at some point. So I would aim for like 2 baths or showers a week, and just some sponge baths in between. Just hit the highlights, don't worry about the rest, and keep on going. So, like I said, just try to stick to their usual time of day for a bath. So if you're the caregiver at home, you have the luxury of doing that. Sometimes if you have home health in or hospice, they're gonna need to do it on their schedule, but just bear in mind that can be a little bit upsetting. So you may have to kind of talk them through that, cajole them a little bit. So have some clean clothes ready for them when they get out, and put them on the bed or wherever you're going to get them dressed in the order that you would put them on, so that like you have your underwear first, and then your socks, and then your shirt and your pants, and so on, so that it's easy for them, and it helps them feel like they're part of the process. Give them a little bit of control. So if you have somebody who's kind of digging in, try not to say, "Daddy, do you want to take a bath?" And because they're going to say no. That's going to be a given. So be a little bit more direct and say, "Your bath is ready," and stay positive, be reassuring, and don't say things like, "Dad, I want you to take a bath after breakfast," because that can cause stress, because now they think, "Oh gosh, I've got to remember something after breakfast." So just avoid that, and just say, your bath is ready as soon as they finish breakfast. So let's see, if they say, "I don't need a bath," and you shouldn't respond with, "Oh yes you do, you haven't had a bath in a week," because that's gonna cause a little argument, a little friction there, and they'll dig in. So you can say, "I don't need a bath," and you can say, "Here's your towel." And he says, "But I don't need a bath." And you say, "Let's get your shirt unbuttoned." And they might focus on unbuttoning the shirt. And they'll say, "I don't need a bath." And you can say, "Well, let's undo your pants here," and just keep going, and most of the time they'll just kind of forget about it and go with the bath, and you can make it through. And respect their dignity. This is going to be hard for them, especially the first few times. If they want to cover themselves, you can, because you have an army supply full of towels there, put a towel over their shoulders. You can put one over the front of their body, and you can even put one across their lap. And then as you bathe them, you just lift up whatever you need to lift up and reach in there and clean it. You know, you can let them clean as much as they can by themselves, because that gives them some control. And if they're not able to do that anymore, you can give them a part in the whole process by letting them hold the soap or the shampoo while you're washing them. And everything you do, you give a little reassurance and a little encouragement. You know, let's wash your left arm. Says, oh, that's great. Now let's do the other arm, and just kind of walk them through one step at a time through the whole thing, and tell them how good they're doing. So, don't scrub. Their skin is very, very sensitive as you get older, and I already know, and some of you may, as you get older, your skin kind of separates. It doesn't stick together in nice tight layers like it was, and so it'll slide on itself, and it will cause skin tears. So don't scrub, just gently, gently wash. Slow down if they look like they're getting anxious, or if they're, you know, you feel some negativity coming out of this, or some negative behavior. You usually just need to slow down. And then when they get out of the tub, instead of rubbing them dry, just pat them dry, and have plenty of towels out there. Check their skin as you're bathing them and as they're getting dressed as you can. You don't have to make a big production of it, but just take a peek at their skin, make sure there aren't any red areas or any rashes or sores. You know, just kind of keep track of them. And if you have home health involved, please let them know. And if you have any questions, I'm a wound and ostomy and continence nurse. I could probably tell you how to treat a simple wound, or what you should do, when to call the doctor. So, and then use a really good body cream or moisturizer when they get out. Try to stay away from things that have perfumes in them, or things that say lotion, unless you know lotion, like a Eucerin lotion, has a lot of oil in it. So that's going to be a really good one. And things that say cream will have a lot of oils in them. They'll be better for your skin. But things with perfumes have alcohols, and alcohol, it feels great right away, but it's going to dry up and really dry out the skin. So kind of stay away from those. So I put some samples of things that I picked up that I like, and things that I've had other people recommend. And I have a lotion there just in case you want to review. Put some lotion on, it smells wonderful. But then in a few minutes, your hands are back to being dry. So I'll let you look at those when we finish up here. There are some good no rinse products if you are trying to do a bath at the sink and you're kind of in a hurry and you don't want to mess with rinsing all the soap out and so forth. You can use that, and it works pretty well. Eventually you really need some soap and water, but in between it works great. The shampoos work pretty well once, and then you kind of need to have some regular shampoo after that. But they are available, and then there are some really nice cloths out there that you can buy in packages if you are afraid if the terry cloth of your washcloth is too hard on their skin. You can try those. And let's see. So anyway, I'll let you have some little sticks out if you want samples of any of these things to try on your skin, see how they feel. So let's talk about oral hygiene now. Okay, so maybe they're getting themselves dressed, and maybe they're doing a lot of things they should do, but they might forget to brush their teeth. So kind of keep an eye on what their habits are. You know, are they brushing their teeth, or are they forgetting? Because there's a lot of little bitty steps in brushing your teeth that they might be forgetting, or they wear dentures and they just think, well, they're fine. They won't even take them out to clean them anymore. Just watch what they're doing. And if you are in charge, you know, of that, try to find a dentist that's had some experience with people with dementia, so that they'll know kind of what we're looking at and how to handle it, particularly if they wear dentures. The dentist can tell you what to look for when you're doing their mouth, because you want to look for anything that might be causing pain, because then they're not going to eat very well, and they're going to avoid things that are real chewy, like some vegetables and things, and their diet's going to degrade, and it can lead to constipation, fecal impactions, some nasty things. So keep an eye on their mouth. And if you have to do their teeth, then tell them step by step everything to do. Like, hold the toothbrush, now take the top, let's get the top off the toothpaste. So hold your toothbrush still, let's put some toothpaste on, and now you brush your teeth. And if they can't, then you put your hand over theirs and help them move it. And if you have to, you brush them yourself. Then remind them that they need to spit and rinse their mouth out. Just every tiny little thing, and tell them what a great job they're doing. And they make toothbrushes that are built up. They have bigger handles if they're having trouble holding on to things. You can get forks and spoons like that too, as a matter of fact. But the toothbrushes work pretty well if they're having trouble with manipulation. And when it comes to when they just can't handle their teeth anymore and they really don't want their teeth cleaned, you can get little sponges on a stick that work pretty well. You just mix up some mouthwash 50-50 with water. Don't put the mouthwash straight in their mouth, it's too strong for older people. So just dip it in the water, and they're kind of scrubby, so you can just kind of scrub out their teeth and brush their tongues and sweeten up their mouth, and they work pretty well. If a person's wearing dentures, the dentures really need to be removed and cleaned every night. They need to be brushed 3 times a day, just like regular teeth, of course, through the day. But if you're in charge of taking care of the dentures, take them out, brush them and clean them and store them whatever way that they've normally been storing them. And then watch for mouth sores. As people lose weight, the dentures your gums will lose weight too, believe it or not. And they'll shift around, and the dentures aren't going to fit quite as well. So if you notice them wincing when they eat, it might be because the dentures are slipping and it's causing a little sore spot in their mouth, and they won't be eating as well. So they won't say anything, they just will stop eating certain foods, or maybe foods altogether. So get back to the dentist and see if there's any way that those dentures can be adjusted. And if they can't be, the dentist will probably have some suggestions, but if they can't be, he can tell you, kind of where we go from here. You're going to need to make some diet modifications, of course, because they're not going to have teeth to chew with. But you want to make sure that they get a good healthy diet. So there are dietitians available here and there you can find and consult with them. You can talk to nurses, home health, hospice, whoever you're using as a provider can help you with the diet too, if they don't have teeth. They're edentulous. So, okay, let's see. And then back to dressing, a little bit more about dressing. When the choosing the clothes gets too difficult, you might want to think about helping them clean out their closet, or you do it. Take out all the excess clutter and outfits that they don't wear anymore, or seasonal things that aren't being worn right now. Just take them out so it's not so overwhelming. And maybe get rid of all the socks and just get all the same socks. so they can choose their socks, because it feels good to be able to choose your own wardrobe, but they don't have to make a choice. They're all just there. And then tube socks are much easier to put on than socks with heels, because they don't have heels, you just pull them on. So those are a good idea. And I would eliminate the belts and scarves and any kind of accessory to your clothing that's probably going to be put on wrong anyway, and they might not notice that they're gone. It'll make getting dressed a lot easier. Clothes that are loose fitting are going to be easier all the way around. They're easier for people to put on themselves, and they're easier if you have to be the one dressing them. And if they refuse to change clothes, then don't argue with them. Just bring it up again a little bit later, because, you know, part of the good thing about Alzheimer's is they forget what you said, so you can start over again in 5 minutes and proceed from there. And if you have buttons and zippers that are too difficult to handle and they don't know what to do, then if you sew or know someone who sews, or even you might even be able to get some that stick on, that you can get Velcro and replace all of that, and then it's easy for them to do. But when you put them in the washer, make sure you attach the Velcro pieces together, because otherwise they'll catch on everything. You can get pants with elastic waistbands. There's a lot of reversible clothes out there now, which is kind of fun. And let's see, just be sure as you're getting them dressed that you tell them everything you're doing as you do it, so that they're well aware of what's going on. So as far as grooming, encourage them to take pride in their appearance. You know, have them look in a mirror once a day and say, you know, look how pretty you are, look how handsome you are today. It's because sitting around in a bathtub doesn't do much for in a bathrobe is not going to do much for their morale. So try to get them up and dressed every day, and have their hair cut in a lengthened style that's not hard to do, and then something that you don't have to curl, particularly with something hot, or even blow dry, something that's real easy that they can do, or you can do. Check their fingernails and toenails pretty often, because they can get out of hand really fast. So if you're cutting them, then go back with a little file and make sure you get all the rough edges filed down so that they won't scratch themselves.
Do you have tricks about cutting fingernails and toenails? Because you would think I was cutting off a finger.
I know, because yeah, they're really, my mother screamed through the whole procedure and I never hurt her. So,
Right.
I usually use the kind that you pinch, you know, the regular ones that most people have at their house, because they can see it, because I think most people, I have cut a lot of toenails in my work, and they'll watch you like a hawk the whole time you're doing it, so they can see where the blade is going, and they seem to be okay with that. And you know, don't cut them too short, of course, because that can really hurt. And then just make sure that you file them. And those little blades on those clippers get dull fairly fast, so have some extra ones around in case you're having trouble getting through the nails. And it does help to kind of soak the nails if they're thick. That helps, and clean them underneath if they have crud, because everybody gets crud under their toenails. So get a little orange stick or something that you can sweep that out with. Get them nice and clean.
I got my husband to agree to a pedicure.
Oh, good. Oh, good.
Trait we go together for.
Oh, that's so nice. Yeah. And you can do it at home too. You can soak their feet and use some olive oil or something on their skin and really massage it in, and a lot of that dead skin will just roll right off. And you've got it all there in a little tub, so you can go change out the water every few minutes, and that works pretty well. Make their feet all silky soft. So now let's talk about incontinence, because that's no fun. Women leak and men dribble. So, you know, at some point they're probably going to be incontinent. Not everybody that has dementia gets incontinent, but most people do. But then there also is incontinence that's not related to their dementia. So the difference is that if they have dementia, if they have dementia, they're declining physically. Their sphincter muscles that control the flow of urine are going to be weak, just like other muscles will too. And it's a little round donut-shaped muscle, and as it weakens, you know, it's not going to be able to hold tight and hold that urine back. So they may start having some leakage problems that they'll probably complain about, you know, at that point. And and they may have an occasional accident, you know, where they have a full-blown urinary episode. But if they have a problem that starts right away, like they never had a problem with leaking, and now all of a sudden they've peed twice on the sofa today, you know, or something's clearly wrong, you probably need to call the doctor. They most likely have a bladder infection. That's real common in elderly people, particularly women. So, and I've seen women act, well, and men too, act really strange when they have a bladder infection. They won't tell you that it hurts. And I don't know if you've had bladder infections, but they can be extremely painful. But a lot of people won't complain about it. But I've had people that would literally walk like this, and the ladies that worked in the nursing home knew these people really well, and they say, oh, she has a bladder infection. And sure enough, every time they were right. So just any kind of peculiar behavior they've never done before, or if they're running fever particularly, you need to call the doctor and have that checked out, because that can, bladder infections can run pretty rampant right up to your kidneys and cause all kinds of problems. So take care of those right away. They make all kinds of incontinence products. There are real nice pads that they can wear in underwear for men and women. There are incontinence briefs. We don't like to call them diapers because that makes them feel like a child. So we call them briefs, and those ones that pull on, just so you know, you can tear them down the side, instead of having the tabs and all, because that's makes them feel like a baby. So get the kind that you can pull on, as long as they can wear those. And then when you go to take them off, especially if they're wet and or soaked or something, don't try to pull them down their legs and have them step out, because they're going to step on it and it's going to, it'll be a big mess. So use the kind that pull on, and on the seams you can just tear them and they'll come right open, and take them off easily. Bowel incontinence usually lags behind urinary incontinence, but not all the time. And once again, if it starts all of a sudden, like they're having diarrhea, well, that usually comes on pretty sudden. You need to check with the doctor. So see what's going on with that. It could be a medication change. It could be that they have an impaction if they haven't had a bowel movement in a few days. Because if that happens, then liquid stool will go around the blockage and show up. It may be a little bit, and it may be more than a little bit, but that needs to be watched for. But generally, just like the urinary incontinence that's related to the dementia, it's usually from a sphincter muscle that's not working quite well, and just the whole coordination of having a bowel movement, which is a big production in your body, is not working quite right. So they don't have a lot of control over when that stool happens. So if you're having a little problem with them and you think they could still sit on the toilet, see that they get in there and their feet are on the floor, flat on the floor, and that they have time to sit there on the toilet and long enough to have a bowel movement. And don't rush. And if they're restless, have them hold on to something, like the sides of the counter or the bath, something that you can put around them that they'll hang on to and give them something to do, and hopefully they can pass their stool. So sometimes they can also, people with dementia will forget to go to the bathroom. So you need to kind of re-examine what's going on there, as they'll forget to look out for the signs that their body is telling them they need to have need to go empty their bladder, and they'll start acting really restless, and it probably means they need to go to the bathroom, but they can't express it. So help them get to the bathroom, a little bit of a reminder. And sometimes you can set a reminder for yourself to tell them that they really should probably go to the bathroom. Or if you're about to go somewhere, take them to the bathroom, because otherwise, the second you get there, they're going to want to go to the bathroom. Done that many times. And if they can't get to the bathroom fast enough, they're moving real slow, or they have a walker and they just can't get there fast enough, don't fuss at them. If they have an accident, it's not their fault. Nobody thinks it'd be a great day to be incontinent. So get them a portable toilet, a little portable commode, which is a pretty simple apparatus. You can bring it into the living room if you need to, and just make sure they have a little privacy and they can use that. If the bathroom is a mystery, all of a sudden they don't know where it is, you can put a sign on it that says bathroom in something that contrasts with the paint again, so that they can find it. If they're incontinent, you probably want to protect your furniture and the mattresses, and there's plenty of different kinds of sheets you can put on beds. There are incontinence protectors for furniture as well. You can use pads. I recommend that you use both, that you use something that protects the cushions, that's made to go over cushions, and then the pads too, because when those diapers leak, they really leak. So you can expect an adult diaper to hold about a cup of urine, which is about a normal urination. So once they get past that, they're probably going to leak. And if they're not too cooperative about getting up for changes or getting up to go to the bathroom, you're going to need to watch out for your furniture. And rugs, if you don't want rugs to get wet, just move them. Or antique furniture, you don't want them messing up, just put it in another room where it won't get used, so that they aren't embarrassed by it. If they get normally got up to go to the bathroom in the middle of the night, keep doing it. It's as hard as it is, it really does help them out, because their body's used to emptying their bladder in the middle of the night. So it might save you a lot of trouble the next morning when everything is soaked. Make sure that you get them clean every time you change a brief, because the urine and the feces have enzymes in them, and enzymes will just chew up your skin and cause some pretty nasty rashes, just like a baby. They'll get rashes just like a baby. And they can also get fungal infections down there too, which are yeast infections on their skin. So look out for that. I have some really nasty pictures of what a yeast infection looks like. So that would be another whole lecture. But basically a yeast infection is a red area that has little dots outside of that red area, and that's a cardinal sign of a yeast infection. So otherwise it's just a plain old rash. So there's all kinds of incontinent creams and barrier ointments and so forth to help protect their skin, but you still have to watch out for yeast infections, just because it's warm and moist and it's dark in there, and that's where yeast loves to grow. And then always, always, always wash your hands when you are cleaning up someone. I like to put on, if I'm cleaning up somebody, well, in any case, I would use gloves. But if you are cleaning up a bowel movement, this is what I like to do. I'll put like 3 gloves on my right hand, or more if it's a lot. You can just pile them on, one over the other. And then as you go, you have, I like to use these adult size wipes, because they're nice and big. So you can get the baby wipe ones if you want, but you're going to zip through millions of them. The bigger ones work a lot better for adults. And as you clean, have a little trash can next to you, and every time you have one to throw away, just take that glove off and it goes down with the trash. And then keep going. You can have 5 gloves on if you want to, and keep yourself nice and clean, but you still have to wash your hands. So the germs are really, really, really tiny. So that's about all I have as far as hygiene and dressing and bathing. But how many of you are actually taking care of somebody in your house? 4? Okay. That is a tough job. And I have all the admiration in the world for you, because I did it too, but I didn't do it as long as a lot of people did, because my mother was a wanderer, so we had to put her in assisted living. But y'all are rock stars in my opinion. I just want you to know that. So do you have any questions?
I have a question.
Sure.
We have a dilemma right now. We noticed, my daughter was here, and she and I both noticed that her daddy had a little dark spot on his tooth in front. So she said, "Mom, you need to take him to the doctor, to the dentist." Okay, well, she went home, and I got an appointment with the dentist, and it was all confusing because we didn't go to the right place, but it's where the insurance company sent me, and anyway, that's another story. But anyway, they gave us a printout of they x-rayed him out and gave him a printout, and it was a rather large sum. So I said, I think we'll go to another place. So I made the appointment for the second place, and we went, and they were very nice. Their name was Scruggs on East 70th. They were just real nice people. And they gave us another printout, and both those printouts are within $200 of each other, but they're $12,000.
Oh my
And
goodness.
I am just,
Wow.
and he doesn't have a toothache.
Uh-huh.
And so to try and talk to him about getting dental work done, and he keeps asking, well, how much will it be? How much, what about this and that and that? And he doesn't have a toothache. And so it's just like I'm pulling it out of the air and wanting to do it for him. And
Is
I
the
just
tooth
can't
dying?
see spending $12,000 on a man's mouth that's 6 months from 90 years old.
Gosh.
I guess I'm just too
Yeah.
scotch with my money.
Well,
I just, if he were a young man and he were gonna keep those teeth for a long time and the bridges that they were gonna put in and all that, it'd be another story. But the fact he doesn't have a toothache, we just can't get, we're just back to square one every time I do something.
are they planning on putting an implant in or something?
No. And
Okay.
that was another thing that somebody said to me, why don't you go and get what do I wanna say, a price on a full mouth of the implants.
Oh,
No, you
I
don't wanna
have
do
no
that.
idea what that would be.
Oh.
No, you'd have to sell your
Price
house.
tag.
Yeah. We're probably talking 40 or 50,000.
Okay.
Easily.
Well, see, when somebody's this age, I just can't see putting them through all the torture that's gonna be. And he can't understand it because he doesn't have a toothache. And my conscience is really bothering me because I'm not doing anything about it.
What they say was wrong with it? Was
That
it
little
cavity?
spot down there it's part of the root